why is the marking so important and critical?
Actually, so if we cannot mark properly, if the lines are not accurate, then results gonna be inaccurate and artificial. So, but we use different techniques to mark out all and bring out all the musculature. So we use light, we use the muscle movement, we use our knowledge about the topographic anatomy. So we have lots of different things we need to bring our practice to find out and mark properly. If you cannot mark properly, you can't achieve the best result.
Some doctors that can mark brilliantly, but they are unable to produce that on the table.
So frankly speech, so you need to educate your hands as well. Mm-hmm. So and end of the day, it's marking. So perhaps some of them has a talent to paint, but then if you don't have enough skills to operate, enough knowledge about the technology, enough experience with the liposuction, canals, everything, of course, not possible.